Hey everyone, welcome back to all my listeners. Now I hope you're all having a great day so far. I know I am. And if it's your first time finding me, thanks so much and welcome. Welcome to Season 7. This is episode number 2. Now, today is Wednesday, September 14th, 2022. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Anyways, you guys, I've got so much to get into today, as usual. So I'm going to be diving into my compliance tips and recommendations today on the ICD10 Coordination and Maintenance Committee meeting. That's happening right now as I'm recording this episode. And of course, it is the second Wednesday of the month after all, so that means I will be getting into the Newsworthy OIG Work Plan updates for August 2022. And I'm going to close out today's episode with the remarkable quote on purpose and impact by Oprah Winfrey. If you checked me out on LinkedIn, you guys know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve your coding accuracy as you help all of your providers paint the medical picture. If you like what you're hearing, please go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts or wherever you listen to my podcast. I'd really love your support. And as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and my recommendations based on my over 12 years of experience in front office, in back end, in coding, and in billing for multi-specialty physicians, in compliance, and in auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. So let's get into Newsworthy. It's the second Wednesday of the month, so that means even in Season 7, I'm going to be going over the month's OIG Work Plan updates. Now, the first OIG Work Plan update for August 2022 is titled States Medicaid Eligibility and Enrollment Actions Concluding the COVID-19 Public Health Emergency. Now, this report is coming from the Office of Audit Services. In response to the COVID-19 pandemic, Section 6008 of the Families First Coronavirus Response Act, or the FFCRA, provides a temporary increase of 6.2 percentage points to each qualifying states and territories' federal medical assistance percentage, or FMAP, effective January 1st, 2020. Now, to receive the increased FMAP, the FFCRA requires states to provide benefits to individuals who were enrolled in Medicaid at the start of the COVID-19 public health emergency, the PHE, or to become enrolled in Medicaid during the emergency period. These individuals should remain eligible for Medicaid through the last day of the month in which the COVID-19 PHE ends, or the continuous enrollment period, unless the individual requests a voluntary termination of eligibility, or the individual ceases to be a resident of the state. Within the 12-month period in which the COVID-19 PHE ends, states must initiate all renewals, post-enrollment verifications, and redeterminations for all individuals enrolled when the continuous enrollment expires. At the conclusion of the COVID-19 PHE, the OIG will review the state's required Medicaid eligibility and enrollment actions. The OIG will determine whether states completed pending Medicaid eligibility and enrollment actions in accordance with CMS requirements that take effect after the COVID-19 PHE. Now, this final report is expected in fiscal year 2024. Now, the second OIG Work Plan update for August 2022 is titled Medicare Payments for Clinical Diagnostic Laboratory Tests in 2021. Now, this report is coming from the Office of Evaluation and Inspections. Medicare is the largest payer of clinical laboratory services in the United States. Medicare Part B covers most lab tests and pays 100% of allowable charges. The Protecting Access of Medicare Act of 2014, or PAMA, requires CMS to set payment rates for lab tests using current charges in the private healthcare market under Title 18 of the Social Security Act. On January 1st of 2018, CMS began paying for lab tests under the new system mandated by the PAMA. Now, PAMA requires the OIG to publicly release an annual analysis of the top 25 laboratory tests by expenditures. In accordance with the Act, the OIG will publicly release an analysis of the top 25 laboratory tests by expenditures for 2021. This final report is also expected in fiscal year 2023. Now, the third OIG Work Plan update for August 2022 is titled PRAC Collaboration on Healthcare Personnel Shortages. Personnel shortages at nursing homes. Now, this report is coming from the Office of Audit Services. The Coronavirus Aid, Relief, and Economic Security Act created the Pandemic Response Accountability Committee, the PRAC. The PARC's mission is to promote transparency and support coordinated oversight of the federal government's COVID-19 response in order to prevent and detect fraud, waste, and abuse, as well as mismanagement, and to mitigate major risks that cross program and agency boundaries. Now, PRAC members includes the offices of inspectors general, the multiple OIGs at federal agencies, some of which operate, utilize, or are otherwise impacted by healthcare programs. Within PRAC, a health subgroup has identified healthcare personnel as a resource critical to the federal government's COVID-19 response efforts. The HHS-OIG will work with the PRAC to produce a report that describes healthcare personnel shortages in federal health-related programs operated or overseen by various federal agencies and summarize best practices for hiring and retaining healthcare personnel for possible implementation. This project will involve coordinating with the multiple OIGs from the multiple agencies. HHS OIG will focus on personnel shortages at nursing homes. This final report is expected in fiscal year 2023. Now, the fourth OIG Work Plan update for August 2022 is titled CMS's Emergency Preparedness Related to Clinical Laboratories During the COVID-19 Public Health Emergency. Now, this report is coming from the Office of Audit Services. Laboratory tests are a critical, important part of early detection, diagnosis, monitoring, and treatment of disease. During public health emergencies or disasters, CMS has the authority to provide regulatory flexibilities and waivers to ensure that Medicare beneficiaries continue to have access to needed health care. To help our healthcare providers and suppliers prepare for these types of emergencies or disasters, CMS adopted a final rule, which is known as the Emergency Preparedness Rule, in September of 2016. The rule required those providers and suppliers to do three things. Number one, to plan adequately for both natural and man-made disasters. Number two, to coordinate with federal, state, tribal, and regional and local emergency preparedness systems. And finally, third, to adequately prepare to meet the needs of patients during disasters and emergency situations. The rule covers 17 facility types, like hospitals, hospices, and long-term care facilities, but does not cover clinical laboratories. Continued laboratory testing during a public health emergency, as well as timely and reliable testing for novel infectious diseases, are important for the health of Medicare beneficiaries. Effective testing for novel infectious diseases, including COVID-19, are essential in helping to slow the spread of these diseases by identifying those who are infected and enabling treatment or isolation if needed. The OIG will conduct an audit to determine whether CMS's emergency preparedness for clinical laboratories could be improved. Specifically, the OIG will look at CMS's emergency preparedness to ensure these two things. Number one, that patients maintain access to all types of laboratory tests, including laboratory tests for novel infectious diseases during a public health emergency. And finally, second, that these laboratories have the ability to develop and deliver timely and accurate testing for novel infectious diseases during a public health emergency. This final report is expected once again in fiscal year 2023. Now, the fifth OIG Work Plan update for August 2022 is titled Reporting of Security Incidents by HHS Contracted Service Providers. Now, this report is also coming from the Office of Audit Services. In accordance with the Federal Information Security Management Act and the OMB Circular A-130, federal agencies are required to ensure external service providers that are processing, storing, or transmitting federal information or operating information systems on behalf of the federal government meet the same security requirements as federal agencies. These requirements include policies and procedures for detecting and reporting security incidents. The OIG will conduct an audit to evaluate the effectiveness of controls at selected HHS divisions to ensure service providers are identifying and reporting cybersecurity incidents. The purpose of this audit is to determine whether HHS has effective controls that ensure service providers identify and report cybersecurity incidents in a timely manner. This final report is expected again in fiscal year 2023. Now, the sixth and final OIG Work Plan update for August 2022 is titled Skilled Nursing Facilities Medicare Payments to Related Parties. Now, this report is also coming from the Office of Audit Services. Understanding skilled nursing facilities, or SNFs, costs is crucial to understanding the factors that contribute to nursing home performance and how nursing homes deliver care to beneficiaries. The cost of services, facilities, and supplies furnished to a provider by an organization related to the provider by common ownership or control may be included in the allowable cost of the provider in an amount equal to the related organization's cost. However, such cost must not exceed the price of comparable services, facilities, and supplies that could be purchased elsewhere. Medicare requires that a reported amount be the lower of either the actual cost to the related organization or the market price for comparable services, facilities, or supplies, thereby removing any incentive to realize profits through these transactions. The OIG will determine whether SNFs are reporting related party costs in accordance with federal regulations. The OIG will also determine whether a SNF's allocation of Medicare funds could impact a beneficiary's care, such as whether overhead costs might have increased while allocations for patient care decreased, potentially reducing care. This final report is once again expected in fiscal year 2023. All right. Well, let me give my 2 cents here on the first OIG Work Plan update for the state's Medicaid eligibility and enrollment actions concluding the COVID-19 public health emergency. Now, I think some states are having difficulties, right, in preparing strategies and effective messaging for their Medicaid patients after the PHE ends. I understand, as do the states, that continuous Medicaid coverage requirements enacted by the FFCRA in March of 2020 will end when the PHE is officially lifted. Again, that could be by the end of October, it could be by the end of this year. We just don't know yet. But the process of resuming eligibility and coverage determinations for enrollment will start up the coverage gaps, right? It will start up the coverage interruptions, right? And it will also start up the coverage losses, just like in pre-COVID times. I really, really do hope that this pandemic has allowed states this very much needed extra time to improve upon communications, their internal policies, as well as their process improvements with their enrollees, and to help millions of patients across the country maintain their coverage or to help them transition to other coverage. So, in my opinion, I always pass this detailed information on to my providers who need it to review their coding and billing practices or their overarching compliance programs. I think these reports with findings are always most interesting and informative, and I look forward to analyzing them in the years ahead. It's also very important for my listeners to pay attention to these monthly OIG Work Plan updates to see how they may impact you, your provider, or your health system. And now it's time for my best practice tips in Trusty Tip. So, in today's compliance tip, I wanted to get us into the ICD10 Coordination and Maintenance Committee meeting that's already started up. That's right. The meeting is in Washington, D.C. on September 13th through the 14th, specific to the diagnosis coding agenda. Now, the CDC has provided Zoom links on their website, but of course, this episode already drops on the last day of the meeting. But do note, this meeting is held every September, so be sure to bookmark the CDC webpage for the ICD-10 Coordination and Maintenance Committee meeting. Now, the webpage has so much information for stakeholders to review. And of course, public comments are requested for this year by November 14th, 2022, for any of these proposed or revised diagnosis codes under review at this year's annual meeting. So, why don't we dive into this year's agenda topics? There are going to be 37 proposals in the diagnosis packet on the CDC webpage already. Plus, there's an additional addendum that will be dropping in another week or so. Now, the topics include these following 37 proposals. The first one is for abnormal rheumatoid arthritis related immunological findings without current or prior diagnosis of clinically apparent inflammatory arthritis. The second item on the agenda is for Acinetobacter baumannii infections. The third item on this year's agenda for diagnosis codes is for acute HIV infection syndrome and HIV pre-exposure prophylaxis, or PrEP. The fourth agenda item is for age-related osteoporosis with current pathological fracture, pelvis. Now, the fifth agenda item is for Alagille syndrome. The sixth agenda item is for anal fistula. The seventh agenda item is for anuria, oliguria, and hepatorenal syndrome in complicating the puparium. The eighth agenda item is for autosomal dominant hypocalcemia. The ninth agenda item this year is for bronchiolitis obliterans and bronchiolitis obliterans syndrome. The 10th agenda item this year is for chronic migraine with aura. The 11th agenda item is for coronary microvascular dysfunction. The 12th agenda item is for dense breasts on mammography. The 13th agenda item is for eating disorders. The 14th agenda item for this year is titled Extraocular Muscle Entrapment. The 15th agenda item this year is for familial adenomatous polyposis. The 16th agenda item is for family history of adenomatous polyps. The 17th agenda item is for flank anatomical specificity. The 18th agenda item this year is for foreign body entering into or through a natural orifice. The 19th agenda item this year is for frailty risk analysis index. The 20th agenda item this year is for immunoglobulin A nephropathy. or IGAN. Now, the 21st agenda item this year for diagnosis coding is for inappropriate sinus tachycardia, or IST. The 22nd agenda item is for insulin-resistant syndrome. The 23rd agenda item is for intestinal microbial overgrowth. The 24th agenda item is for intrahepatic cholestasis in pregnancy. The 25th agenda item is for leukodystrophies. The 26th agenda item is for lymphoma in remission. The 27th agenda item this year is for lysosome-associated membrane protein 2, or LAMP2 deficiency, otherwise known as Danon disease. Now, the 28th agenda item this year is for MED13L syndrome. The 29th agenda item this year is for membranous nephropathy. The 30th agenda item this year is for myelin oligodendrocyte glycoprotein antibody disease. The 31st agenda item this year is for non-traumatic coma due to underlying condition. The 32nd agenda item for this year is titled Obesity in Children, Adolescents, and Adults. The 33rd agenda item this year is titled Phelan-McDermid Syndrome. The 34th agenda item this year is for short bowel syndrome and intestinal failure. The 35th agenda item this year is titled Sickle Cell Retinopathy. The 36th agenda item for this year is for the social determinants of health, or SDOH. And finally, the 37th agenda item for this year is titled Wasting Disease or Wasting Syndrome due to underlying condition. Now remember, if you've had the chance to attend this particular session on September 13th, which was yesterday, or today, September 14th, these can be awarded CEUs for your attendance by either the AAPC or AHIMA members registered for the Zoom. Now, these meetings are important for our coding and compliance professionals, and of course, for all of our providers. So I hope someone on your team can pass this critical information on to them. Their public comments are necessary year after year. And finally, I focus Season 7 Spark on purpose and impact. I want this 7th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires the need for purpose and impact in all that we strive to do. So, in this week's inspiring quote in Spark is from the American icon and female entrepreneur, Oprah Winfrey. Step out of the history that is holding you back. Step in to the new story you are willing to create. Absolutely true, right? I think this is an amazing quote that reminds us to take those leaps of faith. I think this quote reminds us that we have the ability to hold on to our history, to remember where we come from. But this quote inspires us to look even deeper into our fabric. Do we want our story woven with the same threads of the past? Or do we want to emblazon our own story with the vibrancy of new creations? I think this quote reminds us that our own lives can be rich tapestries filled with the colorful threads of our past and our new, our fresh, our very own creations. The stories told in our own unique voices. I think this quote inspires all of us to leave our own legacy of impact behind. I am happy Oprah Winfrey's spark still burns brightly in all of us today. So that wraps up today's episode. And as always, you guys, I appreciate you so much, all of you diving into today with me, week after week, well into my 2nd year. Thank you, thank you, thank you. Now, if you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Now, all right, you guys, this is going to be a heavy final note today. It's not going to be a final fun note. It's going to be a lot heavier. I really do hope all of you had some time to reflect on this past 9/11 that just passed us by, right? So I know I still live the day I went through 21 years ago, every single year, every single anniversary. I spend so much time reflecting on what I went through on that particular day. I've never forgotten any of it. So I just remember I was getting ready for work that Tuesday 21 years ago, and I had the TV on in the morning. I was getting ready for work and the TV was on, and I was trying to pay attention to some early morning news. And the first tower was hit, right? And I was like, what was I seeing, right? I was confused. Like all of us that happened to see it on TV in the morning were very confused. What was I seeing? I remember feeling that. And so then I was flabbergasted and I just plopped on the couch behind me. I just sat down. And then lo and behold, the second tower was hit. So clearly I spent some time just watching in shock, in agony, listening to what the reporters had to say. And so that second tower was hit. And that's when I remember immediately jumping up and opening up my flip phone. I had a flip cell phone back then, to call everybody. But of course the phone lines were not working. They were not working at all. I could not make a single outgoing phone call. So the lines weren't working. And at some point I remember hearing a huge boom in my ears, in my living room where I was walking around, pacing. So there was a huge boom. And at the time, this is good for the story here that I'm sharing, I was living at the time in Arlington, Virginia, right? And that's where the Pentagon crash happened. And that's clearly what I heard, because it was a unimaginable sound. It was so loud. It was a boom. A boom is not even the right word. It was an explosion, a crash. It was deafening. So I was living in Arlington, Virginia at the time, and then I heard that as well. Now, I was all alone. There was no one to talk to, right? Because I couldn't make a single outgoing phone call. I was just obsessively going over the details of my trip in my mind just the week before. So that was my headspace, right? Listening to the news happening, hearing this crash, and then my own mental space was going over the details of this girl's trip that I took just a few days earlier. So I was in the Big Apple in New York City, where my best friends have lived for years. My childhood friends from Ohio, they all live there. And so I remember I was with one of the girlfriends and we were on some boy's rooftop. Don't know who the boy was, but we were on his rooftop. And I remember myself asking the question on his very fabulous rooftop, where are the World Trade Centers? You know, where are those two towers from your rooftop? And I remember she and I both turned around as his finger pointed in the other direction. And I just remember, sighing at the beauty of those two towers in the distance. So that's crazy that I had just talked about the towers from a boy's rooftop in New York City just a few days before 9/11 happened. So completely crazy, right? So anyway, flash forward back to my life in Arlington. I was, like I said, about to head into work in the museum district where I was working at the time years ago. So I obviously did not go into work that day, nor many days after. I don't think we were expected to come into work for the next week or so. But I do remember going into work those following months. Yes, it took months. It took months of us looking at each other on the metro, right? The public train transportation in Washington, D.C. I just remember all of us looking at us, at everybody looking at each other with so much compassion and empathy and concern in our eyes from day to day. It took months for all of us to, get back to normal on the metro, which means, right, like looking at your cell phone, making phone calls, talking to each other. No, it was basically a lot of silence for a couple of months, other than like eye contact and like just giving a, some sort of a sheepish grin of understanding that we were all going through something. So anyways, you guys, that's what I was thinking about on 9/11. So I know all of you probably have some pretty amazing, heartfelt and sad and even tragic stories to share. So I hope you got to do all of that with your friends and family on 9/11. So anyways, you guys, just wanted to share my story with you. So life is incredibly short, so make the most of each and every day that we have left. And please make this an amazing week ahead to the best of your ability. Keep carving out time for yourselves, again, to prevent full-blown stress and burnout. And of course, please continue staying safe and healthy during this COVID-19 pandemic that we're still in. Thank you so much for listening in on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.